Good morning, everyone. I want to thank AIOS for giving me this opportunity here. At the outset, let me just give you a quick brief about why this was done. Of course, each one of us knows how diabetes has come up as a big epidemic, and we are all now trying to get into and educate our patients about the lifestyle changes that they can do. What I understand here, living here for last n number of years, one always believed that people were walking long distances, had very healthy diet in the hills, and things would be much better compared to any other place. But when we do any kind of screening camps of detecting blood sugar levels, just blood sugar levels, you find that diabetes is frequent and common even in the hills where people are like walking and where the lifestyle issues are not there. So there is something happening to us, our diet, the way we are living our lives. When we were planning for a development of some education material for our diabetic patients, we find that we have various subset of population in our hills. Number one, the people may be literate, people may be totally illiterate, or people could be just semi-literate. So needed to know, what do they know, how much, what do they do if they know. So this was an extensive study, and we had taken almost, I won't go through this, but we included all the patients, but there were very few patients who were between the age of 10 and 20. And we excluded all the patients whom we could not examine or who refused examination. So here, what we did was, this was all known diabetics, established diabetics. There were almost 1,600 patients. This study was done not here, it was done in the Tiri District Hospital, Tiri CHC, and in Tiri PHC. So it was not done in the city at all. It was done only for patients who were there. And there we have identified patients who were living in the city itself, Tiri city itself, as the city, though it's not a city. So our population subset was 44% of males and 54% male and 46 female. The age group was on the higher side, 59. So that's why this number is there, that we had 73% rural there. Occupation wise, if you read this word skilled, this was either they were running computer labs of some sort, or they were doing some kind of teaching, or they were involved in tourist thing with a small degree. That is where the skilled came, did not follow the exact skilled as you and I may think. Now among these people that we examined, the prevalence was there in both the subset. Almost the percentage was around 21 point something when we calculated. And in this, most of the patients, they did have mild diabetic retinopathy. Duration had a correlation. There were 2% patients with proliferative diabetic retinopathy. I'll tell you the numbers later. Some of the numbers are not very nice. Okay, now what did we do? We just asked, are you aware of any ocular involvement in diabetes? Simple. आँख को कुछ होता है क्या? That was what. And what you find is that a large number of people are not aware. Women particularly were not aware. Then, if they were aware, are you aware of diabetic retinopathy? Even in that, only less than 40% were aware. And these were patients who were already taking treatment for diabetes. These were not undiagnosed cases. See, I agree that, again, like glaucoma, diabetes is a sight stealer. Patients don't have pain. Patient feels मेरी sugar बिल्कुल ठीक चल रही है, मुझे क्या परेशानी है. So that kind of an attitude is there definitely. When you compare this in comparison to the education status, you find even when people are educated, even when they have access to healthcare, almost 40% are still not aware of ocular involvement or diabetic retinopathy. Now, see, duration again is so important. When somebody has had diabetes for more than 15 years, even then, almost 35%, 36% are not aware that something can go wrong with their eyes. So when you look at that, you decide and you think and you divide, go back and ask more questions. This is what I did. I asked for source of information. Because if you are going to your healthcare provider and he is telling you something, you would probably understand. Now, when I write doctor, this includes all, including the RMPs. But in this RMP, most of the patients who were aware, most of the information came from these people who were diabetologists or were practicing diabetes specifically. Lot of times, the regular physicians are not educating patients about the systemic involvement of diabetes. Then people who knew about diabetes, you can go back and ask some more questions. So, would controlled diabetic have some problem? Again, they don't know. So, almost people who were skilled, even then 24% did not know. In comparison, if you just ask them, is it curable? I mean, they don't know. People who know, even they don't know whether it is curable or not. I forgot to say, we had done this kind of a study for Pauri Gadwal almost before COVID. At that time, this was not there. This time, you find that so many people are getting information from YouTube, and so many people who had some information were actually getting it from what? The WhatsApp University. When you talk about the duration of diabetes, and if they were aware whether diabetics again would have eye problems, or whether they would be prevented, or whether they could be cured. Even with duration, you find that almost 40% did not know anything about it. So this is actually set and subset. I'm sorry about that. When you ask people who are aware, these are the people who were actually aware, would they still go for ocular examination? 42% patients who were aware that something can go wrong actually went. 47%, they didn't know. They were aware, but should you go regularly? They did not know about it. Patients who were undergoing regular examination, most of the patients were coming from the Tiri city itself. From the villages, people were not coming. Again, in that, women were much less compared to the others. I would just summarize here and say something. What we realized was that there was an equal incidence of diabetes and diabetic retinopathy even in the hills, despite their lifestyle. That was one. The second thing was, what we realized was that the patients were not being educated about diabetes-associated systemic involvement, even by primary treating consultant. A lot of patients were getting treatment at the government facility. Few were actually using, I did not put that slide because of whatever reasons. But a lot of patients were getting treatment from the government facility, and I can understand physicians are overloaded and they do not have time to educate when you are at CHC or a PHC or a district hospital level. Lot of patients who actually were getting some information were getting them from their opticians. So that was almost 12% patients were getting it from their opticians. So based on this, actually we devised two education leaflets, one for the semi-literates and one for the literates, and one 2-pager to be given on WhatsApp for patients who are coming to our OPD. Ask their number and give them this, because if you are too busy, just share that. If they are reading WhatsApp, they might as well read it from the right person. So this is something that I wanted people who are here to do, was just have one liner, one page, 4 lines, share it with your patient. Ask your resident to share it with the patient. At least they would know what to do and how to do things better. Thank you so much.
This is really very interesting, especially the use of WhatsApp for education. Also, it's very surprising the way even those who have been diabetics for 15 years, as you said, don't know about it, because they have been going to their doctors, they have been taking their treatment, and still they don't know about it. So that is really eye-opener. Thank you, ma'am.
Actually, some of the things where I was seeing these patients as a VR surgeon, a patient has diabetes for 15 years. आँख क्यों नहीं दिखाया? पता ही नहीं था. So that was something very heartbreaking to us. Thank you.
But I think we, as an ophthalmologist, we are also we are also responsible because common practice we are not seeing each and every patient fundus examination. So thank you, Dr. Renu, for nice presentation.